Giving a blood sample. Blood tests are useful for investigating a wide range of conditions and are very commonly performed. For example, you may have a blood test to see if you have a problem such as diabetes, thyroid disease, or an infection, to assess your general health, or to check the health of specific organs such as the kidneys. Blood tests may also be used to monitor conditions and find out if treatment has been successful. Finger prick testing. A blood sample can be obtained at home using a finger pricking technique. The blood can then be sent to a laboratory for testing. If you have diabetes, finger pricking is a common way of obtaining blood for monitoring your blood glucose levels. Having a blood test is a simple procedure that takes less than 5 minutes. A tourniquet or tight band is put around your upper arm, which makes the vein swell so that it is easier for the sample to be taken. You may be asked to clench and unclench your fist. A sterile needle attached to a syringe or a special vacuum container is inserted into your vein and a sample of blood is withdrawn. After the sample has been taken, the tourniquet is released and the needle removed. You will be asked to press on the site with a cotton pad. And a small adhesive dressing may be applied. You may get a small bruise, but this will fade within a few days. The sample will be sent to the laboratory for analysis. For some blood tests, you may need to fast beforehand. This means you should not eat or drink anything apart from water for 8 to 12 hours before the test. You may also need to stop taking certain medications. If so, your medical professional will let you know. Obtaining a blood sample. A blood sample is usually taken from a vein in your upper arm. If you tend to feel faint at the sight of blood or needles, you should tell the healthcare professional beforehand so that he or she can try to make you feel more comfortable. Thank you for your attention.
So 131 ba yun, Doc? Pathology of fire. Fire is primarily an internal pathogenic factor. The only type of external fire could be considered to be that seen in warm diseases. Fire can derive from a transformation of other exterior pathogenic factors like the wind, the cold, the summer heat, and dampness. But once it affects the internal organs, it is an interior pathogenic factor. Internal causes of fire are the excessive consumption of hot foods and alcohol, emotional stress. Stagnant qi turns into fire, and smoking. The general clinical manifestations of fire are red face, red eyes, swelling and pain of the eyes, tongue, ulcers, mouth ulcers, scanty dark urine, dry stools, bleeding, insomnia, mental restlessness, pronounced irritability, propensity to outburst of anger in liver fire, agitation, red tongue with a dry dark yellow coating and a deep, full, rapid pulse. When used in narrow sense, the term heat denotes a middle form of fire. Heat and fire have obviously the same nature and share similar characteristics. They will both cause thirst, a feeling of heat, some mental restlessness, a red tongue, and a rapid pulse. However, there are some important differences in the clinical manifestations, possible complications, and treatment. Fire is more solid than heat. It tends to move and dry out more than heat. And this nature of fire causes dark, scanty urine and dry stools. Fire moves upward, causing mouth ulcers, for example, or damages the blood vessels, causing bleeding. Also, fire tends to affect the mind more than heat, causing anxiety, mental agitation, insomnia, or mental illness. Main characteristics of fire. As opposed to heat, it blazes upwards, it is very drying, it damages blood and yin, It may cause bleeding. It has the potential to generate wind. It affects the mind. It causes ulcers with swelling. The nature of fire, therefore, is to rise to the head, dry fluids, injure blood and yin, causes bleeding, and affects the mind. In general, the yin points, second points, of every channel clear heat or drain fire. For example, liver 2, heart 8, bladder 66, and etc. Thank you for your attention.
Good day. Today we'll talk about the foot yang men, stomach meridian, stomach 21, liang men, bridge gate. This is the illustration of the stomach 21 point liang men. On the upper abdomen, two chun lateral at the anterior median line, or four chun above the umbilicus. Stomach 21, liang men, bridge gate, beam door, beam gate, or connecting gate. The earth element is associated with the transition period between seasons, as well as with the season called late summer, and the names of stomach 21, 22, and 24 all highlight the importance of processing and the many stages of transition that fall within the remit of the stomach official. Stomach 21, bridge gate, can be useful at the level of the mind and spirit when a person is in a process of transition but cannot fully integrate body, mind, and spirit all together. So they feel erratic and edgy with nervous tension. Keep stopping and starting or blocked from coherent through thought and action. This point can help them unify the processing and experience the calm after resolution of bridging the gate. This point lies on a level with REN 12. Both points affect the stomach. Stomach 21 is mainly used for acute excess painful stomach problems when there is stagnation and heat affecting the stomach, bad breath, gingivitis, restlessness, or rebellious stomach chi causing nausea or vomiting. Used when there is epigastric pain or discomfort, distension and indigestion, and when stomach is deficient and wood chi over controls and invades it, causing nervous tension. It regulates the stomach, clears stomach heat, subdues rebellious chi, stops vomiting, relieves pain and stagnation. Indications: help with mental processing and times of transition, burning in the epigastrium, acute stomach problems, indigestion. Liang Men, stomach 21 is an important point for treating distension and pain due to stagnation of qi, especially in the lateral abdomen and the lateral costal region. It is used in preference to or in combination with Zhong 1, Ren 12, when there is severe epigastric and abdominal pain, particularly in these lateral regions. More widely, Liang Man, stomach 21 is able to regulate the stomach and spleen and transform food accumulation, being indicated for vomiting, poor appetite, borborygmus, indigested food in the stool, and diarrhea, especially slippery diarrhea. This term refers to diarrhea which, because of its persistent and chronic nature, leads to downward collapse of qi. The collapse of qi in turn leads to a worsening of the diarrhea, which becomes ceaseless both at night and during the day, and is accompanied by symptoms such as shortness of breath, loss of appetite, emaciation, etc. The term liang in the name of Liang Men, stomach 21, refers to the one of the 5 accumulations discussed in the Classic of Difficulties. This form of accumulation is said to pertain to the heart and is characterized by a palpable mass in the region below the heart or epigastrium. And the use of young men stomach 21 is emphasized in various classics for epigastric pain and chi accumulation below both the chest and the lateral costal region. If this gate is closed, a person can find it difficult to digest or assimilate things, either physically or mentally. This point can help with the digestion of food and also with the stuck in the mud thinking processes where integration of the BMS is proving difficult. This is particularly relevant in times of transition in a person's life, often used with stomach 22 and stomach 24. This point is on a level with REM 12 and alarm point of the stomach. Thank you for your attention.
Spleen Qi deficiency. This pattern is due to spleen Qi deficiency and failure of transportation and transformation. It is also called spleen failing to transform and transport. Key symptoms: abdominal distension, poor appetite, loose stools, along with a Qi deficiency pattern. Clinical manifestations: abdominal distension or bloating, especially after meals, poor appetite, lack of ability to taste foods, loose stool, lassitude of the body and limbs, fatigue, lack of strength, shortage of qi, laziness in speaking, emaciation, sallow complexion or obesity, edema, pale tongue with a white coating, moderate and weak pulse. Analysis: this pattern is usually caused by irregular diet, overstrain, fatigue damage, overthinking, and overworrying, impairing the spleen, hereditary weakness, deficiency with old age, or improper nursing care in severe diseases. Analysis of a spleen Qi deficiency pattern. Failure to transport and transform will cause failure to transport food and water, causing a hindrance. So this will lead to abdominal distension and poor appetite. There will also be aggravation of spleen Qi deficiency after meals, and this leads to abdominal distension after meals. Weakness in digestion, failure to separate usable and unusable part of the food, then going down into the intestines will lead to loose stools. Failure of transportation causes formation and retention of water dampness. So there will be edema and obesity. Hypoactivity due to Qi deficiency will cause failure to fill up and nourish the body and flesh, leading to lassitude of the body and limbs and a thin body. Hypoactivity due to Qi deficiency will cause failure to raise the clear Qi upward to nourish the face, so there will be sallow complexion. There will also be deficiency of Zong Qi, so shortage of Qi and laziness in speaking. Etiology of spleen Qi deficiency, to summarize, is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, anxiety, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: stomach Qi deficiency, spleen Yang deficiency, lung Qi deficiency. Signs and symptoms: poor appetite, abdominal distension after eating, tiredness, pale or yellow complexion, pale or dark lips, dizziness, low voice, shortness of breath, weakness of the limbs, loose stool, slight depression, tendency to gain weight. Pulse is empty, tongue pale, thick coating. Treatment principles: supplement the spleen, warm the lower burner. Acupuncture treatment: REN 12 to fortify stomach and spleen, stomach 36 to supplement spleen Qi. Spleen 3 is the yuan source point of the spleen. Spleen 6 will also supplement the spleen Qi. Bladder 20 will supplement the spleen Qi in chronic cases. Bladder 21 supplements stomach and spleen Qi. REN 4 supplements Qi. REN 6 will warm the lower burner. We needle with supplementation and moxa. Relevant advice: dietary changes are alpha and omega in the treatment of spleen Qi deficiency. This encompasses both what is eaten and how it is eaten. A person who is spleen chi deficient should eat as much prepared and warm food as possible. They should avoid raw vegetables, salads, food that is very coarse, cold drinks, ice cream, and food that generates dampness, such as sweets, dried fruit, artificial sweeteners, honey, stevia, dairy products, bananas, avocados, and so on. They should avoid eating too quickly, too much at a time, and whilst reading, watching television, or working. They should chew their food well and avoid drinking too much at meal times. They will benefit from eating soups, mashed vegetables, purees, porridge in the morning, stews, steamed or boiled vegetables, and baked vegetables. That is food that is easily digestible and preferably warm. The weaker their spleen chi is, the more digestible their food should be, as long as it does not create dampness. Drinking a small cup of ginger tea at mealtimes will help to fortify spleen yang, thereby assisting the spleen in its transformation of the food. The use of herbs in the diet, especially aromatic spices like black pepper, ginger, cardamom, garlic, cumin, caraway, and nutmeg, will also assist in circulating qi, dispersing food stagnation, and transforming dampness, thereby alleviating the burden on the spleen. Foods that are particularly beneficial are rice, oats, barley, most vegetables, especially root vegetables, squash, sweet potatoes, and those that are yellow or orange in color, red lentils, tofu, chickpeas, and chicken. It is important that the person does not regularly sit still for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial as long as the person does not overexert themselves. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach chi to descend. Meditation is interesting in the context of spleen chi deficiency. Often we recommend yin activities like meditation rather than physical activity when there are chi deficiency conditions. However, meditation where you sit still for long periods of time can burden the spleen, and excessive mental focus can consume spleen chi. This does not, though, mean that meditation in itself is negative when there is spleen chi deficiency. It just requires taking certain factors into consideration. If you're able to meditate with an empty mind, then it will be beneficial. Meditation is also an excellent tool to reduce the tyranny of worry, speculation, and repetitive thoughts. Walking meditation will generally be a better option for a person who is spleen chi deficient, as walking circulates chi in the middle jiao, while sitting still can cause chi to stagnate in the middle jiao. Thank you for your attention.
Let's now go to inquiring. Let's discuss symptoms in pregnancy. For vaginal discharge, a white discharge that is usually thin but large in amount and has no odor is due to deficiency of spleen chi or cold dampness in the lower body. For yellow discharge, this is usually large in amount and is viscid and malodorous. It is mostly due to accumulated dampness transforming into endogenous heat or dampness heat in the lower body. For red discharge, it may be red throughout or interpersed with white and is usually viscid and is mildly malodorous. It is mostly due to suppressed liver qi transforming into fire and damaging uterine meridians. Copious vaginal discharge may also be seen in trichomoniasis, candidiasis, gonorrhea, tuberculosis of the uterine cervix, sena vaginitis, uterine tumor or cancer, or cervical cancer. Some common symptoms in pregnancy. For vomiting, it is due during pregnancy that is very common. It's accompanied by abdominal distension, fatigue, and lassitude. It indicates deficiency of spleen and stomach qi. If accompanied by agitation, irritability, a bitter taste, and regurgitation of acid fluids, it indicates liver fire disturbing the stomach. If accompanied by epigastric pressure, anorexia, vomiting of sputum or saliva, and greasy tongue coating, it is due to turbid phlegm extending upward. An edema during pregnancy is usually in the lower limbs but may occasionally extend to the entire body. If accompanied by reduced appetite and ascites, it suggests deficiency of spleen qi or of spleen yang. If accompanied by cold limbs and lumbar and knee aches and weakness, it suggests deficiency of yin and yang. If accompanied by distension and pain of the flanks and chest, it suggests blockage of qi movement. For fetal distress, this refers to ptosis of the gravid uterus, causing pain, sometimes with vaginal bleeding. If there are also aches and pressure in the waist, dizziness, and urinary frequency, it is due to kidney insufficiency and inability to nurture the Chong and Ren meridians. If there are also a light yellow complexion, fatigue, and weariness, it, a pale tongue, and a depletive and a feeble pulse, it is mostly due to insufficiency of qi and blood, so that the fetus is not adequately nourished. If there are also distension in the chest and flank, agitation and irritability, and the thought pulse, it is mostly due to stagnation of liver qi. Abdominal pain and vaginal bleeding that result from falling or straining is due to injury of the Chong and Ren meridians. The condition is threatened abortion in Western medicine, belongs in this category. Thank you for your attention.
Let's now discuss physical examination strategies, assessment techniques. The physical examination requires you to use your senses to assess the patient. You collect objective data regarding various aspects of the patient's health through sight, hearing, touch, and smell. Though strategies are discussed separately, it is important to realize that the history complements and validates the physical examination. The history and physical examination are the foundation of the treatment plan. The history obtained provides clues and guides you through the physical examination process. As the examination begins, some components of the examination process may prompt you to return to the history. Discreetly incorporating some history during the examination process facilitates the exposure of the principal or sometimes underlying diagnosis. Interacting with the patient. When conducting a physical examination, remember that encounters with the human body may be discomforting, embarrassing, and sometimes distressing for the patient. Your comfort level should never become so great that you forget about this often invasive experience for each individual patient. Respect the integrity of the patient while maintaining a professional courteous approach. Gaining the trust and confidence of your patient is essential for obtaining an accurate history and physical examination. As you are examining the patient is simultaneously examining you. The patient will note any hesitation or tone changes in your voice, how long you spend assessing certain body systems, and your facial expressions. Determining the scope of examination. Physical examinations are of two types, comprehensive and focused. As with comprehensive health histories, a comprehensive or head-to-toe physical exam should be performed on all non-emergent new patients who will be receiving ongoing primary care from a particular provider or group of clinicians. A focused physical examination is performed in emergency situations and/or when the patient is already under the ongoing care of the clinician and presents with a specific problem-oriented complaint. Assessment techniques. Inspection. Inspection involves collecting data through sight and smell. Upon first contact with the patient, you observe mannerisms, gait, stature, and various other physical qualities. Inspection provides significant insight into underlying diseases, disorders. Knowing what to look for and what it means helps focus inspection. Palpation involves using touch to collect data. Palpation is used to determine such characteristics as temperature, texture, tenderness or pain, and sensation. It is also used to establish information about internal characteristics, such as enlargement of the spleen. Depending on the amount of pressure applied, palpation can be characterized as light, moderate, or deep. Various aspects of your hands are used to assess different things. Percussion uses stopping to assess underlying structures. Percussion of a structure causes vibrations which can be felt and heard. Percussion is used to establish such qualities as location, size, density, and reflex. Percussion may be direct or indirect. With direct percussion, use your finger or hand to strike or tap the surface of the patient's body directly. For indirect percussion, place your hand over the surface of the patient's body and with the other hand, strike the first hand. Percussion sounds may be described as tympanic, hyperresonant, resonant, dull, or flat. Auscultation entails listening to body sounds and is particularly important for assessing the lungs, heart, and abdomen. Most auscultation requires a stethoscope, so it is critical that the provider invests in a high quality stethoscope that has excellent sound quality and is comfortable to use. Before you buy one, consider the following. Ear tips. It is important to use an ear tip size that best fits your ears. When the ear tips are in your ears, they should fit snugly, not loosely, so that the sound or acoustic performance is clear and loud. All ear tips are available in small and large sizes. Poorly fitting ear tips can result in a poor seal, which can lead to missing critical sounds. The seal. Stethoscopes rely on an airtight seal to transmit body sounds from the patient to the practitioner's ears. Loose parts in the chest piece and loose or cracked tubing can prevent an airtight seal. The bell. When using a double-sided stethoscope, you can use either the bell or the diaphragm. Sound quality and volume depend on a quality bell. Tubing. The tubing should retain its shape and flexibility even after being folded tightly into a pocket. Ideally, it should be made of material that does not contain materials that would irritate a patient's or provider's skin, especially those with allergies. Make sure the tubing is double lumen so sound is magnified. Thank you for your attention.
Let's now go to acupuncture for emergencies. Let's discuss viscera-type stroke for acupuncture treatment. In a young blockage stroke, the main symptoms are sudden onset mental confusion or loss of consciousness, spasticity in the limbs, trismus, flushed face, fever, snoring, gurgling of sputum, restlessness, anuria, and constipation or convulsion and hematemesis. The tongue is crimson red with yellow and greasy coating. The pulse is stout, slippery, and rapid. For therapeutic principles, uh, one can open the orifices with acrid cool herbs, cool the liver, and extinguish wind. In yin blockage stroke, the main symptoms are sudden coma, hemiplegia, placidity, cold limbs, pallid complexion, cyanotic lips, copious sputum, and saliva. The tongue is dark or pale with white and greasy coating. The pulse is deep and slippery or even. For therapeutic principle, open orifices with acrid warm herbs, eliminate phlegm, and extinguish wind. In prostration stroke, the main symptoms are sudden loss of consciousness or coma, flaccidity of the limbs, incontinence of urine, sweating with cold limbs, eye shuts, spastic tongue, retracted testes, and a shallow and weak respiration. The tongue is cyanotic with white and greasy coating. The pulse is either deep and even or indistinct, thread-like, and on the verge of collapse. A therapeutic principle, you can augment qi, rescue yang, and arrest collapse. For acupuncture treatment, can use for blockage stroke, select the 12 well acupoints governing vessel 26, liver 3, and stomach 40. Use filiform needles and apply the reducing method. The well acupoints are pricked with a 3-edged needle to cause bleeding. For prostration stroke, select the acupoints CV4 and CV8. Apply ignited moxo cones of these acupoints. Thank you for your attention.
Let's have erectile dysfunction, damp heat in the lower burner, clinical manifestations, impotence, difficult, painful urination, turbid urine, itching of genitals, urethral discharge, tongue sticky yellow coating with red spots on throat, pulse slippery. Treatment principle: resolve dampness and clear heat from the lower burner. Right? Points: spleen 4, pericardium 6, lung 7, kidney 6, liver 5, liver 3, liver 1, spleen 9, spleen 6, ren 9, bladder 22, ren 2, ren 3, bladder 34, all with even method. Explanation in acupuncture: spleen 4 with pericardium 6, open and regulate penetrating vessel, the Chong Mai. Lung 7 with kidney 6, Mai. This can be 5, liver 3, liver 1, eliminate dampness from the genital system. Spleen 9, spleen 6, ren 9, and bladder 22 eliminate dampness from the lower burner. Ren 2, ren 3, and bladder 34 resolves dampness from the genital system. Thank you for your attention.